Heroin, the word that comes from the German word heroisch, which means heroic, but heroin is far from being the hero in America's history. Heroin is a very real problem that we face every day in America, and there seems to be no solution. So what's the best way to go about helping heroin addicts? How bad is the heroin issue in America, and what is its significance to our society, and why do we need to do something? What are our options to fix this? Medication, therapy, new laws? What options have worked before for other places? And why will these options help our epidemic? What evidence is there to support that these options will work? How has the heroin problem in America skyrocketed in recent years? Dramatic increases in heroin issue in recent years. There's some astounding statistics by McCoy. In one study, they found that in 2001, there was a reported 6,000 deaths from heroin, while there's a stark contrast to the over 20,000 that is reported in 2014 from the same drug. That's over a 300% increase in deaths. Imagine that I had just told you that asthma-related deaths had increased that same 300% in 13 years. People would be shocked to hear that, so why are people not shocked to hear about heroin? Another study from an article called Groundbreaking Study Explains Why People Use Heroin explains that the average age at which a person first tries heroin is 18 years old. Along with that, more than 75% of those in the study had a concurrent mental health illness such as ADD, bipolar, or depression. So are people getting exposed earlier, or are people using it for self-help for mental health issues? Prescription opiate medications are also a gateway drug to heroin. In a 10-month study of suburban citizens, it was found that most had little knowledge about drug prior to using it, and 1/3 of those turned to heroin after becoming addicted to prescription opiates such as OxyContin or Vicodin. In another study from Kuhn that ran over a 3-year period found that 2,500 people in the survey, out of the 2,500 people in the survey, a whopping 66% they had switched from prescription opiates to heroin because of money reasons. People also stated that the ease of obtaining the heroin over prescription drugs and also the huge difference in costs was a huge factor. For example, one single tablet of OxyContin costs about $80, while on the other hand, a small bag of heroin costs about $5. With absolutely insane statistics, what are our options? What can we do to fix this? Here are some options that have shown some promise. So what changes can we make using medications? Well, there's a drug called methadone, and according to the article, methadone treatment is a practical solution to heroin addiction. It is a treatment that has already existed in America for over 30 years and has been by far the most effective treatment we have. While many people who start this treatment will have to be on it for the rest of their lives, it's still about 10 times cheaper than heroin to use than heroin over a year's time. From that same study, they found that laws have made obtaining methadone very hard. Patients must find a special methadone clinic to receive their medications, sometimes having to travel to the clinic daily. But wouldn't it just be easier to allow methadone to be prescribed by a patient's primary care doctor rather than making it difficult through the clinical setting? A study in 2000 found that current policy puts too much emphasis on protecting society from methadone rather than protecting people from addiction. Instead of being too strict on legal drugs that can help people, people are too concerned about the what-ifs. But what if that person was your child, your spouse, or your father? You would want them to have the most help available to them, not restrict them. Some other ways that we can help is by making heroin less deadly. According to SEAL, naloxone, or Narcan, is considered by many to be a miracle drug. It has no health risks, no abuse potential, and does not hurt those who have not actually had an overdose. And how about this statistic? Drug overdoses now kill more people than car accidents in most states. Because of this, many states are opting to make Narcan easier to obtain, going as far as arming drug addicts with the drug in case they were to witness an overdose of another person. McCoy states another option in preventing overdose death are supervised drug injection sites. In these areas, addicts could come, shoot up their drugs, and be supervised by medical personnel in case of an overdose. Along with this, addicts that come to these areas will receive other services such as counseling to help them stop their addiction. So we have these options, and you're probably wondering how effective these are. So let me give you some facts. In the study by Keiko, Grandblen, Kirsten, and Joachim in 2004 to 2006 showed that 80% of participants in a methadone study had clean urine samples that were free from drugs during the study. Along with using the methadone, they also participated in behavioral health therapy. Another study by Chen and Fujiwara studied methadone treatment not only reduced the percentage of active heroin users participating, but also reduced antisocial behaviors, theft, and prostitution. And while Narcan is not a long-term solution, it was responsible for saving 829 lives in a single state, and possibly more that were unreported. So what are some other evidence leading us to start a change? McCoy states that supervised injection sites have been around for decades in other countries such as Germany, Switzerland, and the Netherlands, and they have used them and have had great success, and they've even expanded. Not only do these injection sites reduce overall deaths, but they also decrease crime in the area and improve health and social functioning of addicts, along with offering referrals for addicts that are looking to get clean. And while some people think that a place like this would attract more users, injection numbers have actually gone down from over 1,000 injections a day to about 600. So whether we use medication or supervised areas for drug users, or a combination of both, we have a good chance of helping those addicts and ending the epidemic. We know that heroin is a terrible drug that can hold on to addicts, sometimes until death, but there are steps that will work, and we just have to let them work. So remember, we are not helpless in this fight. We have the ability to make these changes so we can not only improve our society and its citizens, but also save somebody's mother, son, cousin, or friend who is struggling and losing this fight with addiction.